we have a new name for the coronavirus. The World Health Organization has officially called it Covid-19.
In regards to coronavirus,
the new coronavirus variant.
The Philippines reports its first deaths linked to the Omicron COVID variant.
I want to talk about COVID. In particular, the main reason why COVID is still with us in 2022. Hi, welcome to another episode of The Take. My name is MJ, and thanks for joining us. If you have not yet subscribed to this channel, kindly consider doing so by clicking on the button down below. Now let's get to the topic of this video. It's been more than 2 years since the first case of COVID was reported. Yet COVID continues to be a global pandemic that is wreaking havoc everywhere. I want to talk about the main reason why COVID-19 is still with us in 2022. And that main reason is global inequality. Social and political markers of identity, such as race, class, income, nationality, gender, are still strong determinants of who gets to access healthcare in many parts of the world across the globe. Another way we have seen this global inequality manifesting itself in global health is in vaccine distribution. When vaccines were first approved, distribution was only strictly limited to developed countries that could afford the vaccines at the time. And this was not the first time that we saw such a pattern. We saw this at the beginning of the HIV and AIDS pandemic, where rich countries had the antiretroviral drugs, could produce them, but they were strictly limited to the developed countries, while everybody else who could not afford the medication was left to die, majority of whom were people in developing countries. And I covered this in the video Vaccine Nationalism. I'll put a link in the description, I'll put an icon somewhere up there, where rich countries gathered for themselves more than they needed to secure it for their own populations, while the rest of the world was unprotected and left vulnerable. And because of such inequality, there's a lot of evidence that the lack of vaccine access has led to mutations of the Delta variant and now the Omicron variant. And this is why global inequality in global health is one of the main reasons why COVID-19 is still a pandemic that is wreaking havoc across the globe. Perhaps one could ask the question, is the future of a continent like Africa doomed? Given it's a continent that does not have the capacity to produce its own vaccines, at least at the pace that is needed in order to combat this pandemic. I don't think it's that easy. And that is why it is very important for countries, for continents, for regions to be self-sustainable when it comes to vital areas of their economies such as education and health. And I covered this in also another video that I'll link in the description, where Africa is constantly cautioned to strive for sustainability when it comes to vital and critical areas of its livelihood. Health and education are such key areas. The main policy for health across the African continent cannot be heavy reliance on donations from the West or from China. The African continent must strive to be self-sustainable and to cater to its own population. While global inequality is a major challenge that is perpetuating COVID-19, there is an array of other challenges that are also contributing and perpetuating COVID-19 as a pandemic. Given all these factors that are perpetuating COVID-19 as a pandemic, and given mutations such as the Delta variant and the Omicron variant, many people may wonder why even bother to be hopeful to fight COVID-19 as a pandemic. Here's a reassuring message from the World Health Organization.
We've heard a lot of people say, well, why bother? Omicron is everywhere and I might as well just get infected now. That's a very dangerous question. and it's one worth answering. The reason we don't want this virus to circulate is, number one, your chance of developing severe disease is real. If you have underlying conditions, are of an older age, if you've not received a vaccination, you could die. And that's what we want to prevent, and we can prevent that. But you can also pass the virus to somebody else who is more vulnerable. We are just learning about post-COVID conditions, long COVID. We don't know the implications of Omicron, which replicates in the upper respiratory tract as opposed to the lower respiratory tract, and if that has any implication on your chances of developing longer-term effects. So that's reason enough not to get infected. There are so many unknowns about this, about an acute infection as well as long-term effects. I've heard some very scary stories about parties of people trying to get infected. Please, that is very unsafe. We are working very hard with all of our partners around the world to give you advice to reduce your chance of getting infected, to reduce your chance of passing the virus onward. This is critical right now. It is not the time to retreat. It is not the time to give up because we have these tools. We are not talking about shutting down societies. What we're talking about is increasing coverage of vaccines, making sure people have access, as well as simple measures to keep yourself safe.
I made this video for two particular reasons. First, I wanted to raise awareness about COVID. As a public health expert myself, I find great interest in the complexities of pandemics and diseases and the vulnerabilities within our societies that they expose. But raising awareness is also about reminding us that there is more that we can do in order to combat ourselves and keep ourselves safe. And to remind all of us to keep seeking quality information from the necessary bodies such as the World Health Organization. The second reason I made this video is to add my voice to the debate and to the call for justice when it comes to the way we organize our global health. Health is a right and not a privilege. It is not right that only the few who can afford and only the few who happen to live in certain areas and certain zip codes get to have access to quality healthcare, while the rest of the world is left to die. Pharmaceutical greed and putting profits in front of human lives has never been a model of health that has served us well. Until next time, stay safe. This was The Take.